Hello, I am Pharmacist. Today we talk about Penicilline G, its pharmacology, uses, side effects, contraindications, pregnancy warnings, drug interactions, and dose of Penicilline G. Pharmacology. Penicilline G is a beta-lactam antibiotic that works by inhibiting bacterial cell wall synthesis. It binds to penicillin-binding proteins, which are enzymes involved in the formation of bacterial cell walls. This leads to the disruption of the bacterial cell wall, resulting in bacterial death. Penicilline G has a narrow spectrum of activity against mainly gram-positive bacteria. Uses. Penicilline G is used to treat a variety of bacterial infections, including streptococcal pharyngitis, syphilis, and meningitis. It is also used for the prophylaxis of rheumatic fever and for the treatment of infections caused by susceptible strains of Staphylococci, Streptococci, and Pneumococci. Side effects. The most common side effects of Penicilline G include diarrhea, nausea, vomiting, and allergic reactions. Other side effects may include seizures, kidney damage, and anemia. Contraindications. Penicilline G should not be used in patients with a known hypersensitivity to penicillin or any other beta-lactam antibiotics. It should also be used with caution in patients with renal impairment or hepatic dysfunction. Pregnancy warnings. Penicilline G is generally considered safe to use during pregnancy. It is classified as a pregnancy Category B drug, which means that animal reproduction studies have failed to demonstrate a risk to the fetus, but there are no adequate and well-controlled studies in pregnant women. Warnings. Penicilline G should be used with caution in patients with a history of allergic reactions to penicillin or other beta-lactam antibiotics. It may also interact with other medications, so patients should inform their healthcare provider of any other medications they are taking. Drug interactions. Penicilline G may interact with other medications, such as probenecid, which can increase the concentration of penicillin in the blood, and tetracyclines, which can decrease the effectiveness of penicillin. Dose. The recommended dose of Penicilline G will depend on the type and severity of the infection being treated. It is usually administered intravenously or intramuscularly. The dose may need to be adjusted in patients with renal impairment or hepatic dysfunction. The usual adult dose for syphilis is 2.4 million units administered intramuscularly. Thank you.